Hi, my name is Khadidra, and I did my project on syphilis. So on this slide, it basically shows what syphilis may look like. This is not, this is actually not the only way that you may see syphilis. Syphilis can be dark spots on the palms of your hands or the soles of your feet. And as you can see on these pictures, they can come in clusters, and most of the time they're firm, red, round, painless, and sometimes wet. So if you have a syphilis sore, it could easily be mistaken for a bump or like um, a hair grown bump, because it will go away. So sometimes you'll just have one bump, so that it doesn't always have to come in clusters. And sometimes it does go away within, anywhere between 3 days to 6 weeks. So this is what it looks like. Who's at risk? So this is a very great chart that gives a good breakdown of all the people that may be at risk for catching syphilis. These are people that are having unprotected sex, people that are having multiple sex partners, men's having sex with other men's, mother to child transmission, so this is a passive infection, and HIV positive patients. Okay, so syphilis does have 4 different stages. You have the primary stage, the secondary stage, the latent stage, and the last stage, which is the tertiary stage. So in the first stage of syphilis, you're just going to see sores at the original site of infection. And if you continue to have syphilis, you will get to the secondary stage, which then you'll have rash on your skin, you'll have swollen lymph nodes, and you may have a fever. So the latent stage, there's no signs and there's no symptoms. The last stage is the tertiary stage, and this stage is very severe, and anyone that is in this stage should seek medical help, because in this stage, not only will you have sores, rashes, swollen lymph nodes, fever, but you'll also start to have problems with your heart, your brain, and other organs in your body, your neural system. So syphilis cannot be cultured from the resource that I've seen. So syphilis cannot be cultured. The only thing that a person can do that to diagnose it or to see if they have syphilis is to take a serological test. So basically, a serological test um, measures the amount of antibodies present in the person's blood when their body is responding to a specific type of an infection, like syphilis. So syphilis cannot be cultured. Okay, so syphilis is acquired, like I said earlier, um, not only through sex, but oral sex, kissing, touching, and any type of other direct contact. And the way that it does, the thing that Treponema pallidum does in general is it enters the mucosal membrane, and it may remain dormant. for, I don't know, about a couple of years or probably more. It just depends. Okay, so the cause of syphilis is syphilis infection is caused by the Spirochete T. pallidum bacteria. T. pallidum is solely a human bacteria and does not naturally occur in other species. It can survive drying, well, it cannot survive drying or exposure to disinfectants. Thus, fomite transmissions like toilet seats or chairs or countertops is virtually impossible. And there's just a picture of the bacteria Treponema pallidum to the right. So signs and symptoms, as I said earlier when I was showing syphilis on the penis and syphilis on the skin, syphilis also can be, as you can see, on your hands and the soles of your foot. So normally you'll get rashes on the palms of your hand and soles of your feet. You'll have fatigue, hair loss, and swollen glands. Some other symptoms and signs could be sore throat, weight loss, or muscle pain. And remember all of the other symptoms as well, signs and symptoms that comes from the 4 stages, the primary, secondary, latent, and tertiary. You had sores on the original site, rashes on the skin, swollen lymph nodes, fever, and heart problems, brain problems, neural problems, organ problems, and things of that nature. Diagnosis. So we discussed this earlier. Well, I discussed this earlier. In diagnosing syphilis, a serological test is definitely taken, which is just like a blood sample. And that way, you're able to see the amount of antibodies in your blood. And this will help you actually confirm the presence of antibodies that's trying to fight the infection. But the good thing about the serology testing, um, the bacteria can be in our body for days. So this test can actually be used to determine a current or a past infection. So you can test and see if someone currently has syphilis or if they've had syphilis in the past. And at the top right, there's a picture of how syphilis will or would look under a dark field microscope, because a dark field microscope is one of the only microscopes that is used to see syphilis. And this is a microscope that we went over in lab class, so I definitely remembered it and thought I'd add it on this slide. So basically, the dark field microscope excludes the unscattered beam from the image, making the field around the specimen dark, and the specimen itself is bright. So that's the picture. So treatment. So syphilis is treated with benzathine penicillin. You can either take a single intramuscular injection or you can do 3 doses a week intramuscularly. So basically, if you're taking a single dose, it's because you're either in the primary, secondary, or early latent stage. And if you're taking 3 doses a week, it's because you're at the latent stage. And once you take the benzathine penicillin, it will kill the syphilis bacteria and prevent further damage, but it will not repair the damage already done. So prevention, I chose to use this chart again because these are all the people that, well, these are the type of people that are at risk. So these are things to prevent from doing: having unprotected sex, multiple partners, do not have sex with the same men, having sex with men, HIV positive patients, and mother to child. So if you're pregnant, well, if you have syphilis and you're pregnant, well, just try not to get pregnant if you have syphilis because you don't want to pass it down to your child. And I also added to wear condoms and get a regular checkup just to make sure if you're having signs and symptoms that's similar to the signs and symptoms of syphilis, that you get treated as soon as possible.